Hello everyone, and welcome to week 1 of Contemporary Issues in Public Health. Welcome to the unit, and welcome to spending the next 14 weeks with me. I am the unit coordinator and tutor for this unit. My name is Catherine. Please contact me at any stage using the email here, or come and see me. Some of you I will have met previously, some of you will be new, but I definitely are always accessible via email. If you want to talk about any of the tutorial content, if you want to talk about your assessments, if you're not understanding any of the concepts, please come and talk to me. I'm only too willing to help you through this unit and hopefully through learning some new and interesting concepts. So this unit is really to build on your knowledge of what you have learned over the last 2 years around public health. Well, I'm hoping to stretch your critical thinking, get you to start thinking about things around you, about the contemporary public health world you'll be working in, and start looking at it through a lens that you can apply the skills that you have been developing. To learn through this unit, there will be lectures and online learning materials each week in a views folder. This is going to be a series of sometimes only 1 or 2 short lectures, some readings, and then activities for you also to work through. The idea of this is it's a dynamic and fluid learning, flexible learning. Instead of sitting in an hour lecture, it gives you a variety of mediums to work through and read and further develop your knowledge base on some of these topics. We then will have a weekly hour e-tutorial with myself, where we're going to take that knowledge that you've started to gain through the materials of the week and the topic of the week, and have a bit of a robust discussion. We might do this in several ways through different activities, but we really want to look at the pros and cons of each side, how we can apply our knowledge as practitioners, and how we can then take this knowledge forward into the workplace. But the discussions within these e-tutorials will be assessed, so it is expected that you come with prior learning and knowledge to that tutorial so we can have those discussions. The more you can engage on these topics, the more you're going to get out of this unit. You could also bring some additional evidence that you may have found during the week after reading some of the articles that I've put up. And look, I constantly find things coming up that I think, wow, that's interesting, that will apply every day. There's an article that I found this morning actually that I'm going to add to the Views site today about sugar tax. So it's such a fluid and mobile environment, public health, that often things come up during that week. If you see something written in The Guardian, if you see a journal article, if you see something written in The Conversation, bring it along and share it as well. That would be fantastic. In terms of assessments, you've got 4 main assessments broken up throughout the session. The first one, which I've talked about just a moment ago, is tutorial participation. So we will be looking from weeks 3 to 14 to assessing that engagement and your knowledge around each topic, and the different viewpoints you can bring as well. There's no right or wrong. It's very much an open environment for you to start discussing some of these issues. You then will have a literature review that is available, which will be due, on Sunday the 14th of April. And this is a systematic style literature review. We really wanted to lift your academic searching skills. And we're going to be working with the librarian on how to actually produce a very rigorous literature review. This is an important skill that you're going to take forward with you into that workplace. If you're able to know how to develop a systematic literature review protocol and then apply it, that is something that's going to stand you in good stead. We then have a professional task, which is when you take the topic that you have chosen to develop your literature review on into an applied project. So we're going to get you to conceptualise how you might be able to turn this into a policy or an intervention to deal with that situation or that health issue that you have just identified in your literature review. So they're both on the same topic, but they're both looking at different elements. And we'll talk much more about these two as we go through in the sessions, as we go through the session as well. Finally, you'll present on that chosen topic. You effectively are becoming an expert in that area. You're going to have the background knowledge through your literature review, and then you're going to have the forward thinking on how we can address this contemporary public health issue with your outlined project or policy. So you're then going to take that information and present it as a professional via views in weeks 11 to 13. So that's about the unit and the assessments. Now we're just going to have a little look about where we're starting with all of this. What is it all about, and where are we heading with this unit content? So the first thing that springs to mind is the word contemporary. What does contemporary even mean? What are we talking about when we're talking about contemporary issues? It's talking about belonging or occurring in the present. So we're really talking about the public health issues that are here and now and are going to be affecting us forwards into the future, ones that we really need to be focusing on that are going to have big impact on health outcomes for huge populations over the foreseeable future. It's contemporary meaning of the present time or modern, and obviously there's going to be a lot of public health issues that have only become current in the last 5-10 years. Shift in geopolitical conflicts, movement of people, a whole lot of change is continually occurring globally, and how we deal with those health issues and health outcomes for populations is our role as a public health practitioner. And what is present and current in society? And I think that's a very important concept to grasp as public health or preventative health practitioner. What is current in society? What is actually an issue? It's all very good to make policy, but if it's not relevant and it's not current and it's not coming from that moment in that society, it's not going to be applied and it's not going to be successful. So that's what I also want you to start thinking about this unit is how can we bring relevance to our practice, and how can we bring knowledge and relevance to deal with these health issues. In public health, as you are now well aware in your third year of a public health degree, is that it is really about the science, and it's important that we know that it is a science, but it's also an art in the prevention of disease. So we take that wealth of scientific knowledge, that medical science, and we bring that together with that sociology and how we can then take this forward and prevent disease within society. So I'm just going to pop up some pictures and get you to think about how some of these issues might present as public health, as contemporary public health issues within our society. So we've got the Kardashians there, something that a lot of young adolescent girls aspire to. And then I just want you to think in the public health framework, how that imaging that they see on social media all the time may be a detriment to their health, but may also be a positive aspect to their health. And that's why I want you to look at the positive pros and cons and critical thinking about these issues as well. And again, media and social media and streams of public health, how do these affect public health issues? Then we've got diversity and equality. What's the changes? How are we moving with these contemporary issues within the public health sphere? So I'm not going to give you answers. I want you to think about these pictures as I put them up and how they might fit in to your thoughts as a public health practitioner. Food safety, still looking at communicable diseases and the management of diseases. So what is that role of new public health? We've still got the need to control disease, we've got the need for diversity and equality, and we've got the added influence of the digital world, social media, TV, advertising. How can all of these be addressed in the public health sphere? And that's what we really want to look at in this unit of contemporary public health. So we're just going to take a little bit of a walk back in history, and hopefully, having completed the public health introductory public health unit, you'll have a good understanding of that very step-by-step sort of history of public health. And we know that in the Victorian era, we're really looking at the fact that public health was thought to be about miasma control. You know, the stench within the street and the reason why people were falling terribly ill and huge rates of infant mortality were due to a bad smell. we now know that that was actually all due to infectious diseases. But, you know, back in history, at that point in time, that knowledge and that evidence wasn't there. So we then moved forward from that. We then worked through John Snow and the fact and his epidemiological work, and taking the handle off the Broad Street pump, and knowing that we could actually look at it isn't just the bad smell, it was actually a controllable factor in the fact that it was in the drinking water. If we provided clean drinking water, we provided infection control. And that was when the move into public health became very much focused on that preventative healthcare, but primarily focused on that medical model and that infection control model. Particularly post-war, we looked at a whole lot of inoculation or vaccination programs being rolled out around smallpox and measles, mumps and rubella, which have had huge impact in raising or decreasing the rates of infant mortality and disability within children, and generally improving the health for all in developed countries and developing countries. But it was very focused on that medical prevention. We then moved more to the health promotion view and the Ottawa Charter, and looking at healthy environments and preventative health in terms of the Ottawa Charter, and how we can look at healthy communities and participation in healthy communities and movement and exercise, and how the health outcomes can be increased for the population through engaging the community. So the question now is, where are we for public health? What is the new public health moving forward? Is the health promotion Ottawa Charter stance the only solution moving forward? We still need infection control. So how do we encompass all of these aspects? We now know that obesity is a global epidemic. It's in every country globally. You're looking at double burden of disease in developing countries with high rates of obesity, particularly in adolescents. And then you're also still looking at huge rates of malnutrition in infants and stunting as well. In the Western and developed countries, it is a huge crisis. We have hit crisis point, and we're not seeing a great deal of improvement. The rate of obesity is still increasing, chronic disease is increasing, and that cardiac, stroke, all the comorbidities associated with obesity as a risk factor are also causing a great burden of disease. So is our viewpoint in public health, or is the way that we are managing public health working at the moment, or do we need to start thinking of something else? And that's what we want you to start thinking about. We know that obesity is old news, and we know that the whole concept of you just got to change what you eat. You've got to move more. You've got to up to that individual choice, that preventative choice through an individual level of choice is not necessarily the answer. We need to start thinking about bigger systems. What are the systems behind that person's choice? Why are they eating those foods in the first place? Is that because there is no access to other foods? Is it because of the heavy market of food to that age group? We need to start thinking about the systems and the environments behind those individual choices. We need to think about beyond just those obvious individual choices. So for a new public health, we need to move beyond just those simple terms of empowering the individual and equality. Now, they're very important, and they're still a very important aspect, but we need to look at bigger levers of moving and bigger levers of change that involve policy and bigger macro systems. We need to address the changing and emerging issues from a constant change in social, political and economic forces. We see a huge flux and change every day in terms of how things trend on social media, what adolescents and youth are being exposed to now via digital media forms as to what they were being exposed to 10 years ago. We've got constant change in geopolitical forces, and then in turn, we also have a huge disparity and change within the economics within countries and within our own country as well. There was a report that was released just today showing the fact that in the last 3 years, we've seen a greater gap in that disparity between the richest and the poorest people within our own country of Australia, and how we as public health officials still provide equal opportunity for health outcomes for those is important to think about. Public health needs to be responsive, it needs to be new, and it needs to be emerging. It can't be bedded down in this slow chug of policy or thought that's important, but we also need to be able to respond in a manner that is relevant to the time, a manner that is embedded within society, a manner that is understood by society and mindful of other issues. And it needs to be insectorial. We can't work just in our own silo. We need to be working with justice. We need to be working with early childhood. We need to be working with education. We need to be working with government. We need to be across many, many different disciplines to really make sure that we are embedded within society. So what does policy have in the new era of public health? And that's $1 million question. We know that for a lot of systematic change, we need to have big policies in place, but we also know that there is an awful lot of politics that happen behind the policy. And we know that as public health practitioners, we need to be able to work between what might be the viewpoint of the government of the day globally to then also ensuring we get better health outcomes for others. And how do we do that is dependent on the evidence and how we can work as better policy brokers as public health officials as well. We need to have more of an effective global strategic framework, a bit like I was talking about the silos. We need to become those global citizens. We need to be working with people in the States. We need to be working with people in the UK. We need to be working with people in Asia and our neighbouring countries such as Papua New Guinea. We can't work solely in the realms of our own borders. We're going to have people crossing borders. We're going to have people moving. We're going to have diseases moving. With the age of transport and flight, we can't work solely within our own borders anymore. And advocacy. Often in global political standpoints and national standpoints as well, that may not be the best outcomes for preventative health, we need to become advocates within ourselves. We need to be able to drive evidence-based policy. We need to become the voice for those disadvantaged people. And we also have to think constructively and creatively. We need to think beyond just briefs and ministerial briefs. We need to think about how we can use tools such as social marketing. We need to think about how we can build social media into the new public health paradigm. If we're going to reach all of the fabrics of society, we need to be able to work across all spheres as well. So we really need to think about that multidisciplinary, intersectorial approach and underlying causes of what, and we also need to focus on what still those underlying causes of premature death are, because that is our role. We want to prevent premature death and disability. We want everyone to have a long, healthy, enjoyable life. We also need to remember the important role of epidemiology and our evidence base comes back to that science and the fact that public health is a science. It takes that rigorous epidemiological study and looks at how we can then apply that knowledge and reduce that disease exposure and occurrence. So what is contemporary public health? Well, I want you to have a think about what contemporary public health is for you. Where do you see yourself working? Where do you see the biggest health issues in society? What do you think could be done about it? Because you are going to be the face. You are the new public health, and you will be taking this in your journey forward.